Almost all of us have been impacted in some way by the cold and flu season. Both are bad to come down with, but the flu much more serious. Well, Dr. Jose Barquin, board-certified emergency medicine physician from AdventHealth, is here to break down the two and tell us when we need to go to the ER. Welcome to the show, Dr. Barquin. How are you?
Thanks for having me, Natalie.
So let's break it down. I feel like right now we are in peak. I hear it every day. Flu, cold, who has it, who doesn't, what's the difference? So let's start there. What is the difference between the two? Because sometimes the symptoms can be kind of confusing, especially this season.
Yeah, they can be very difficult to distinguish, the flu from the common cold. The flu and the common cold are both respiratory illnesses, and they're caused by viruses. The flu tends to be a little bit more severe, more uncomfortable than the common cold.
I always think flu and I think fever and chills. And is that an accurate kind of description? Or?
You are right. As far as symptoms between the two, influenza, the flu tends to come with fevers, body aches, muscle aches, chills. You can also have some weakness and fatigue. Those symptoms are much more likely in the flu compared to the common cold. Common cold, usually runny nose, sneezing, some congestion, less likely fever, muscle and body aches. The flu tends to be more abrupt in its onset, hits you like a train. The common cold a little bit more gradual.
So when it comes down to the symptoms, and maybe you're guilty of this, we see someone starting to get sick and you always make that comment, well, you better go see a doctor. Well, that's like 3 different ways you could do that. Now, let's talk about when you need to go to the ER versus the urgent cares that we see versus your primary care physician.
Yeah, that's a great question. It's always a great place to start with calling your primary care doctor. If you're certain groups of individuals are a little bit more high risk, like pregnant women, older individuals, especially with multiple medical problems, very, very young children, specifically any child less than 12 weeks with a fever. Those individuals, you may have a lower threshold to go to an urgent care or a ER if you can't get in to see your primary care doctor. The adults that have problems breathing, chest pain, confusion, any unsteadiness, those are some red flags that I would go directly to an emergency department for. But if you only have a mild illness, then you want to try to avoid the ER because that's where you can go and get the flu from patients with flu symptoms and flu in the ER. And stay at home, and unless otherwise indicated by your doctor, medications like ibuprofen, acetaminophen, Motrin or Tylenol, those medications can do a lot to control the fever and to help you be a lot more productive in your day, help you eat, help you sleep, and help you just be more comfortable. Children, the reason you want to take the child to the emergency department, you're going to want to look for things like rapid, fast breathing, signs of dehydration like a child who's crying and not producing tears or cracked lips. Any child, again, less than 12 weeks old with a fever as well should be seen in the ER.
I like that we broke down the symptoms. Is there any truth or benefit to actually having like the test? You hear people say, oh, I got a test for this, and yes, I sure enough have it. Any benefits there if you think you have it, or should you just kind of stay home and do the things that you just had mentioned? Yeah,
that's a good question, and it really depends on your situation. There are, again, some high-risk groups, so if you're one of those individuals, or if you're around those individuals, then it may be a benefit to go to a physician or a clinician and to get the test done. You may benefit from knowing so that you can keep yourself away from those high-risk groups, especially if you have older family members at home or very young children.
And you said before we got started, the key to combating always the flu vaccine, right?
Yes, the flu vaccine worked great this year. It's very important to have that at any opportunity for anybody, but specifically those high-risk groups as well should talk to their doctor about getting the flu vaccine.
I know there's like so many people, even like in our offices, that are all talking about this, and we really appreciate you coming in and talking with us this Medical Monday. Okay, well, again, if you have questions for AdventHealth, all you have to do is just check out yourcareyournetwork.com. Again, Dr. Barquin, we appreciate you. Thanks for your time today.